if you're joining us. I see connecting to audio happening. If you're joining us from the waiting room, hello. Thanks for coming. Megan and Sherry, I see, are here. We have a few more people registered. Hopefully, some more people will pop in. Um, and I'm going to give everybody just another minute or two before I launch into the spiel. Oh, and here's Kenda. There's Kenda. And she's connected. Good morning. Well, it's not morning, it's 2 o'clock in the afternoon. I'm so thankful that you guys took some time out of your day today to join us. I'm going to give everybody just another minute or so um, to get themselves in to this great meeting. And although it's not a meeting, I don't know, session. We were just having a debate about what you could call a webinar without saying the word webinar, because webinar now, everybody's like, ugh. To the great party, to the great think tank.
Like webinars too are very like, I'm receiving information, whereas
Right.
like trying to make this participatory, so then it's like more like a workshop or like a discussion.
I was like, maybe we should call them sessions, but then that makes me think of like music, like we're gonna jam.
Yeah, I'm into that.
Oh, okay. Well, it's 2 o'clock, so I'll launch into the spiel, and as people come, they'll catch up to us. Thanks for coming to the INA Diversity Series webinar with my new good friend, Olivia Samples. Um, I will let her introduce herself in just a minute, but I wanted to thank Adventure Nannies, which is the agency that sponsored our whole diversity series, for stepping up and helping us fund these webinars. Adventure Nannies is a nationwide placement agency, and they really truly believe in supporting the nanny community. They do things like they have their own series of webinars and sessions, whatever you want to call them, that are free or low cost. In fact, some of them are participating this weekend on a Montessori in the home environment session that they did for a low cost for nannies. They place with families, like I said, all across the United States, live in and live out. And if you're looking for a job, make sure you stop by their website at adventurenannies.com and take a peek. And for sure, like them on social media so that you can see all the wonderful things they do to support the nanny community. Um, and in particular, with a mind on supporting families that are diverse in nature as well as nannies that are diverse in nature. And that is my spiel about them. I love them so much. And if you have any questions, make sure to reach out to me or reach out to them directly. Um, so we have somebody else joining now. They're connected to their audio. So everybody's muted when they came into the meeting, but we ask that if you're not talking, you remain muted, and you can have your uh, cameras on or off. But as Olivia said, there's some participation, so I'll let you know if you want to. You can also use the raise your hand button if you have a question, or type it into the chat, and I can make sure that Olivia sees it, and we'll try to answer your questions. And this is a part two. There is a part two to this presentation. There's so much to talk about, and we just scheduled it for in January. I think January 16th. Is that what we did?
Mm-hmm.
Now, see, I didn't write it in the right place. But anyway, you'll get an email to remind you of that, and you'll have to re register, but then it will also be available on replay if that date doesn't work for you. We made it a little earlier in the morning. Sorry for my West Coasters, but um, there you go. All right. So, as I said, this is my good friend now, new friend, Olivia Samples, and I'm going to let her describe to you a little bit about what she does and what she's going to share with us today. Take it away.
Hi. Yeah. Hi. Thank you, Sue. Yeah. Thank you for inviting me to present to y'all. I'm super excited. I do a lot of facilitation, so I'm excited to talk to more folks who work with families. This is a very participatory session that I have created for us. So I would love if y'all participate. I'm going to ask y'all some questions to think about some things. If you don't participate, it'll be really awkward and I'll just talk at you. That's cool too. But we will see what happens. Lord, there's too many tabs. Okay. All right. Cool. So y'all can see that? Yes. Beautiful. Thank you. Okay, so yeah, today we're talking about roots in our context and current reality. So I kind of split this presentation into two once I designed a presentation for y'all and then realized there was no way that I could talk about all of that in 1 hour. My intention today is really just to ground us in like the context of history of reproductive justice for Black women in this country. This presentation is very specific to Black women because that's what I have expertise in and feel most comfortable talking about, but I can also talk about some like international things that have happened and for other communities as well. This is my jam, what I love to talk about. So if y'all have anything that you want to like go on a tangent or know more about, feel free to jump in. There's only like 5 of us today, so I'd be happy to do that. So there's my face. I am Olivia Samples. I own my business, Kismet Doula Services. I'm a holistic doula, which means I'm a labor doula, a postpartum doula, a lactation counselor. And I specifically rooted my services in a framework of reproductive justice, which we're going to go through today, and also in the social determinants of health. So thinking about the ways that people need support where they live, work, and play. So things like helping my clients go to community gardens and learn how to grow food, learning how to pick healthy food or like what grocery stores are available in their communities, finding green space and making sure that they find time to get outside. I live in Iowa, so that's kind of hard right now, but we plan through it. And yeah, I just really love supporting families. I've been a doula since 2018. And before that, I was a sexual assault advocate and a sexual health educator. So reproductive justice work is my jam. And yeah, so I'm excited to talk to you about this today. So I based my presentation today in a reproductive justice framework. I think it's really important to talk about reproductive justice as we talk about like sexual health for folks, because this framework really encompasses, I think, a holistic view at what it means to have children. So reproductive justice is basically a framework that was created by a group called the Women of African Descent for Reproductive Justice in 1994. And this group of women was a diverse group of women of color, as well as trans and non-binary people, who decided that it was really important to create this framework. It hadn't existed previously, and they recognized the ways in which kind of around that time, the pro-life and pro-choice debate was happening, and the ways that a lot of the issues they were facing were not included in that. The group that created the framework for reproductive justice took it to the United Nations in Cairo in 1996. And so the reproductive justice framework is actually a part of it's internationally accepted as a human right. Yeah, so it's a human rights framework. And I think it's really important to ground ourselves in what internationally is accepted as human rights, because sometimes in our country, we think about what is the law in America, but thinking about what our human rights are and generally, I think is a really good way to ground ourselves. So reproductive justice has actually four tenets. We'll get to the fourth one later, but the three that we're going to talk about right now are the right to have children, the right not to have children, and the right to parent the children we have in safe and sustainable communities. I think that this definition is extremely comprehensive, which is why I like it and use it in my work. Do y'all have any thoughts about this definition? Is there anything that you think it's missing? Have you heard of this before? Now's the time. You can unmute yourself or put it in the chat. Let me know. Okay, I'll keep going. Cool. So the first one that we're going to talk about is the right to have children, and I'm kind of going to describe like my work as a doula as well as we kind of go through this. So the right to have children. So historically, we have like for Black folks specifically a denial of humanity. So Black folks are brought to this country as property. They were used as property until the 14th Amendment, which like reversed the 3/5 compromise that said that Black folks were 3/5 of a person, made them full human beings in 1868. Thinking about like the fact that slaves came to this country in like the 1600s, late 1600s, it's pretty crazy. Yeah, that's a long time to go without being recognized as a human being. And that really affects our right to have children, right? Because if full adults are not considered human beings, then also the fetuses or their children off the continuation of their family line would also not be considered important. And then we also have the separation of families, which it was illegal and discouraged for people, Black folks, to marry or have families. Slave owners would separate them specifically because they knew the power of having like close ties to someone and also the potential of like uprisings. So that was also denied, which really impacts our right to have children and the ways that we can have families. And then in the 1880s, there was the rise of the eugenicist movement. Actually, in 1883 is when it was first written, the word like eugenics. And it's really interesting, the eugenics movement in America. Part of that includes like Margaret Sanger, and you might have heard of Margaret Sanger as the founder of Planned Parenthood. And she was quite prolific in the eugenics movement in America. And eugenics means not only the wanting to eliminate like genetic characteristics of folks that are considered undesirable, but it's also the upholding of traits that are considered desirable. So eugenicists not only affected and harmed people who were mentally ill, who are Black, who are other people of color, but they also upheld and found additional social supports for white folks to continue having children. And then forced sterilization was part of the eugenicist movement, but I think it's really important to mention the ways that Black women have been forced into sterilizations or coerced into sterilizations, the ways that people who are mentally ill have been forced into sterilizations. Actually, an article just came out this week about the ways that the state of Iowa, which I live in, has funded sterilizations for mentally hospitals for people who are mentally ill, which is a really contentious issue. And then lastly, the medical experimentation. So a lot of people don't know the history of a lot of the procedures that we currently have, especially related to maternal health. But like many of the procedures that we use commonly today were experimented on slaves without their consent, without any use of anesthesia. So just uplifting that pain that, like, for example, the C-section was perfected on slaves, right? So, and the way that that still has a legacy today. So thinking about things like generational trauma and the ways that those things still live in your physical body, the DNA, the trauma is passed in your DNA. And so when folks are going into hospitals now and the threats of C-sections and the ways that C-section rates are on the rise in America and also one of the highest in the world, I think that has a really big impact on where we're currently at. So looking at these things, here comes another moment to participate. Looking at these things, are there any like direct lines that y'all can think of to what's currently happening in America related to maternal health from these issues? And in history, well, also they're not necessarily still in history. A lot of these things are still happening. But yeah, do y'all think, can y'all think of any correlations or things that might have come out of these historical events? You can put it in the chat or say it out loud if you want. I'll give you the answer in like 2 minutes.
Well, the separation of families, we just had that with the immigration um, situation that we had in the last year or two, 4 years, I guess.
Mhm.
So that's clearly still an issue for immigrants to this country.
Yeah, absolutely. The separation of families is something that's continuing today. Indeed. Um, Also, like the eugenics movement has made like somewhat of a, I don't know the word, revival. Um, Recently, more folks have been looking at the characteristics that maybe make someone um, a really good example is actually COVID, right? So we're thinking about the ways that they're prioritizing folks in for hospital beds, right? Like some of the characteristics that make someone like less able to survive. But that is part of actually eugenesis. Um, okay, here's the answer. So there's also maternal and infant mortality. So this like denial of humanity and the medical experimentation that has happened in the past contributes to, Kenda said, the little that I have read, this really explains why women of color are not taken seriously when going to the doctor. Facts. Yeah. So thinking about like that denial of humanity, that forced sterilization and experimentation definitely has been ingrained into our medical system and contributes to maternal and infant mortality indeed. Reproductive health access as well. So thinking about the ways that like it, as folks were denied being human beings, they also were denied social services. So reproductive health access and having services that serve communities that maybe historically have been underserved is also a really big issue. And then maternal care, similar to reproductive health access, that just accessing care that is affordable, that is in your language, maybe that is respectful of your cultural background, is also quite difficult. Okay, so the right to not have children. There was an act prohibiting the importation of slaves in 1807. And this basically came out of the fact that some states were starting to stop having the importation of slaves. Basically, I think the history of this act is actually really interesting if you, as something to like read up on more if you're interested. But then that created an environment in which slave owners could not continue importing slaves, so they had to continue their workforce somehow, some way, and that took the form of slave breeding. So they would basically lock folks in rooms together, like multiple men with one woman, tell them that they had to, like a lot of really violent things with that. But basically forcing folks to have sex and continue generating a workforce. There's also infanticide, which is basically the killing of infants. So slaves, this is something that's very controversial, but slaves in a lot of historical documents are said to have been killing their children if they did become pregnant. So thinking about, and one of the books that I recommend at the end is Killing the Black Body. And in that book, there's an account from a slave who says that she just didn't want to have her children grow up in the world that she was living in. And I think that's almost a little bit relatable to me right now. Like I can't imagine having a kid through a pandemic, through the political situation that we're facing, through like loss of jobs, unstable housing, all these things that folks are going through. And so that was also something that was going on historically. And then sexual assault. So the ways that sexual assault has not been protected or eliminated in this country. It was especially for Black women as slaves, and then even throughout Jim Crow, assaulting a white person or assaulting any person really would put you in jail. So the idea of, and then also coupled with these stereotypes that we have of Black women being sexually promiscuous, like a Jezebel, things like that. Sexual assault was not taken seriously and still is not really taken seriously for Black women. And then we also have the Hyde Amendment. So, and our right not to have children. The Hyde Amendment basically legalized abortions for specific cases of incest or rape. And before that, even before Roe, like before abortions were legal, people were having abortions, obviously. And the Hyde Amendment made it so that people who experienced these severe cases were able to receive abortions, but it didn't actually increase access or prevent incest or rape or anything like that. Yes. Any other thoughts about the right not to have children or things that come up for you with this? Okay. So some things in our current reality relating to this is sexual health education. So the ways that sexual health education is not standardized or required in our country. And I think that really has a big impact on our right not to have children and just to be educated about our bodies. Reproductive health access. So like I said before, the right to abortions, the right to family planning services, contraception, things like that. And then abortion access, because we know although Roe legalized abortions, abortion access is a separate issue. The price of abortions is prohibitively high. Insurance doesn't cover it. Things like that that make it, although legal, still very difficult to obtain. So the last one is the right to parent the children we have in safe and sustainable communities. So this, I think, is really important, especially as I'm presenting to y'all who are nannies. This is probably the one that affects the work that you do the most, right? So thinking about parenting children and the care of children. So historically, some things that really have impacted this is the right to vote. So the 14th Amendment gave Black men the right to vote, but we know that Black women didn't get the right to vote until much later. So having a say in your policies that are happening in your community, in your state, and your country is really important. Economic justice, so thinking about things like the wage gap for Black women, for Black men, and the ways that folks cannot always provide for their families. And so that's also an issue. And then environmental justice includes so many things, something that I've just started getting into more recently, but thinking about the ways that the environment that we live in has been polluted, that it has been like deprived of resources. So thinking about things like Standing Rock for Native folks and the ways that like the Dakota Access Pipeline is going through their like sacred lands. Thinking about like the disposal of waste from companies and the way that that disproportionately is in Black and Brown neighborhoods. Things like that. It goes on and on with environmental justice. And then public safety, I think, is a major one, especially after the summer that we've had, thinking about being able to parent safe communities. And with this one, I'm totally thinking about too the ways that we've seen on social media, just so many acts of violence towards Black people. So parenting, you know, infants and young children, but also thinking about like teenagers and young people who are on social media and who see these things constantly. Does that contribute positively to our right to parent children, or the fact that those children feel safe in their community? No. And then violence prevention, so thinking about like domestic violence as well as state-sanctioned violence, but thinking more about interpersonal violence and the right to feel safe in your community. And then lastly, mass incarceration and the ways that we know mass incarceration more deeply affects communities of color, and there's a great disparity in that. Yes, we have had a summer of thinking about a lot of these things, I think, if you've been paying attention. So, and then lastly, everything else. The world is crazy right now. Like everything is horrible. And so thinking about like our right to parent children in safe and sustainable communities, are any of the communities we live in safe or sustainable right now? Questionable at best. And so all of those things like deeply affect maternal health. Thinking about all of these things, even with just toxic stress and the ways that just thinking about these things causes stress on your body, that's obviously going to affect our families, our bodies, our health, and our communities. Well, I flew through this presentation because I thought y'all were going to talk at me, so we might have to go back around and chat some more. So all of those sad things, right? Like all of this history that our country has like not been good to Black women, to Black people, to people of color in general. All of this horrible history, right? But we also are living in this time of like Kamala Harris being our first Black woman vice president. We have in this picture, she's standing with Representative Alma Adams from North Carolina and Representative Lauren Underwood. I think she's from New Jersey, question mark, somewhere on the East Coast. And they put forth the Black Maternal Health Momnibus Act in 2020 this year. And that act creates, has comprehensive policy reform for maternal health landscape for Black women. Actually, it would affect a lot more women than Black women, but it's focused on Black women. It includes things like having insurance coverage up to a year postpartum, which right now it's about 30 days or 60 days, depending on your state. It includes things like reimbursements for doulas nationwide. It also includes AIM, which is, I'm not going to think of the acronym, but AIM bundles, which standardize care for emergent situations in maternal health. So this bill is pretty major and it passed. Amazing. So we also have some beautiful things happening, right? And then we also have like this picture on the bottom right is from a protest this summer where someone was like holding the sign that says "Say Her Name," where they're uplifting the names of Black women who've been murdered by police. And this summer, I think, is a really eye-opening time in our country, right? That we're all, maybe not all, but a lot of folks are thinking about state-sanctioned violence, thinking about the conditions that Black folks are living in. And then I think like the way that our popular culture has latched on to like Breonna Taylor, for example, being on the cover of O Magazine or on Vanity Fair, and the way that her name has been shared really widely because of her story. I think that's bringing a lot of awareness to violence, to the conditions that we're living in, and I think that's a huge step forward. So we're also living in this time, despite all of this horrible history, there has been progress. And then I wanted to share some further like reading and resources with y'all. So I'm a member of the Black Mama Matters Alliance and Sister Song. It's like $50 to be a member for the year. And Black Mamas Matter Alliance has a toolkit that you can download for free, which talks all about all of the policy solutions that they're pushing forward, all of the issues, all of the everything around Black maternal health. They are truly an expert and an amazing resource. There's also Sister Song, which is the what the Women of African Descent for Reproductive Justice turned into, the organization Sister Song, which still exists today. So the founders of that definition of reproductive justice are still doing this work, and they are a really amazing resource as well and share a lot of tools, resources, workshops, and they have an annual conference as well. This book, Killing the Black Body, is where I got a lot of the information that I shared with y'all today, by Dorothy Roberts, who is a scholar and a lawyer. That book, massive and amazing. Like, if you want to know about Black maternal health or reproductive justice for Black women, that's the book that you need. It's so comprehensive. It's a history of reproductive justice from Black folks like stepping foot in this country through like pretty recent history. And it's a really thorough analysis, talks a lot about like eugenicists and really important figures in history. And I just, yeah, always recommend that. I also recommend the book When They Call You a Terrorist, by Patrisse Cullors. That book is more of a like personal account of Patrisse Cullors' like life and her experiences. She's one of the founders of Black Lives Matter, one of the 3 founders. And I think it's a really, if you're interested in Black Lives Matter, if you're on the fence about Black Lives Matter, I think her memoir is really a beautiful thing to read because it's just her personal experience and like how she became who she is. And I think that personal experiences are really powerful for shifting folks' mindsets. The next one is Women, Race, and Class by Angela Davis. Angela Davis is still around, kicking ass. She was a Black Panther. She is just a very well-known person. If you don't know of Angela Davis, go look it up because she's a very well-known person, and I think just like an idol to have in life. And this book especially like talks about the current like dilemmas that Black women are facing. This book is, I think, from like the 90s. It's not a recent book, but I think it's a classic. And Angela Davis is one of the foremost like experts on speaking on racism and Black women. So would recommend. And then a book I'm reading right now is We Live for the We by Dani McClain. It's all about the political power of Black motherhood. Dani McClain is a scholar, and I got to meet her a couple of years ago at a talk she was giving, and she speaks about like the ways that Black women can harness political power, about the power in personal stories and experiences, about just what advocacy can look like. And I think that's a really beautiful book too, if you're interested in like going further down this trail. Does anyone else want to throw out any resources that you've heard of or enjoy?
No, but I do have a question for you, Olivia.
Oh my gosh, tell me.
Okay. So I actually have two questions. So my first question is, can you speak a little bit, and at the risk of sounding not woke, can you speak to how generationally some of these injustices still affect women today? Like, how does that perpetuate itself? Because a lot of the things, happened a long time ago, and we've passed laws, but how is it still affecting the women today?
Yes. Okay, I'll just go back. We'll talk about it. Okay, so okay. So some of these things I think are still affecting people today in the ways that, so the first thing I would say is in generational trauma. So the study of epigenetics is the study of how trauma is passed like physically in your body. Like when you're in your mother's womb, the trauma that she's experienced is like literally infused into your cells. And so you're carrying that with you like physically in your body. Like they've done studies where they show like people who are the descendants of like Holocaust survivors, like one of the studies that I read, she like went to camp and had to sleep in bunk beds, and she like freaked out, like had like such a response to it, and like she doesn't know where that comes from, but it's like in your line, right? So I think that's the one thing of how it's actually like in your body. And then I think it's too the continuation of ideas. So like this denial of humanity that started when folks like brought Africans to this country still is a common idea. We just don't speak about it in the same way. So whereas people historically were like, this person is my property, they are not a human being, I get to treat them in these ways, and that was like legislated that was allowed. Now it's not legislated that is allowed, but we still have those ideas, and it just plays out in different ways. So like the denial of humanity, one example that I can share with y'all is like when my very first doula client, and this is something that is very widely talked about in like maternal health spaces, like the denial of pain for Black folks. It like was part of medical journals, thinking again about eugenicists and the ways that they biologically their biological evidence for racism. So the ways that we denied humanity, they were like putting, it's because they have smaller brains that we're allowed to deny them humanity. So putting those kind of facts behind it. But the denial of humanity goes to the denial of pain. So one of my clients, my very first ever doula client, it was her 21st birthday. She's in labor. She was sick. She had been vomiting for like 3 days. She finally came into the hospital, and they're like, okay, we're going to put you on an IV. And she's terrified of needles. We have already discussed this. And so I was like, okay, we have talked about that when they need to put an IV in, we're going to do this breathing exercise, and you're going to squeeze my hand like whenever something is too much. So we're going through our plan of how she's going to like handle this, right? And they couldn't find a vein. And so they I was like, let's wait. Let's do some exercises to like get her veins to pop out more. Let's drink some water. Let's go on a walk. There's like so much you can do to like get veins to pop out for you. But they were like, no, we have to do it right now. And so they stuck my client like 27 times with needles, like looking for a vein. And so she's sitting there, she's terrified of needles, she's sick, it's her 21st birthday, she's sobbing, and she's just like, can we please stop? Can we please stop? No, we have to do it right now. And so that like denial of humanity isn't a policy, it's not legislated, it's not anywhere as part of that, but it's still a belief that's passed down that she's experiencing, right? Like if you really cared about someone and you see this person who's like bawling, you would just be like, oh, my bad. Like I'll just give you a minute to like go through this. But that denial of her pain, that denial of her like being a human in that moment, is an idea that's passed down continuously. So I think that's also a way. And even the ways that like her mom was telling her, like, when I had you, I was terrified. And so her mom passing down those fears to her as well. I think that's how that continues to be passed. Is that your only question? Did you have a second question? Did I answer your question?
You did. I have another question, but I'm not. Somebody just privately messaged me. She's in her car listening to you. So, can you
Okay,
talk
great.
a little bit more about Planned Parenthood and the connection with you, the eugenics? And
Yeah.
she's just starting to hear about this connection and just wonders what's going on.
Yes. I would also recommend Killing Black Body again. She actually does a really thorough analysis on this because it is like very multifaceted issue, and there also were like Black folks who were involved in eugenics, not surprisingly. So, but yeah, I can talk more about that. Basically, I will also say disclaimer that I am a Planned Parenthood Speakers Bureau member, so like I work with Planned Parenthood actively still, um, although they do have this history. But the history is so Margaret Sanger is one of the founders of Planned Parenthood, and she known, not a secret, just like very Googleable, that she was a prominent eugenicist, and she really believed that um, white folks should be having kids and people who are like not fit should not be having kids. And she started Planned Parenthood um, primarily to put sexual health services in Black and Brown communities, primarily so that they would stop having children. So in the time that I can't remember exactly like the years that this is, but the eugenicist movement was like very popular and gaining speed around the 1880s, as I said. So in the early 1900s, there were new birth control methods. The history of how birth control methods have also been tested on different communities is a whole other thing. But they were putting Planned Parenthood specifically in Black and Brown communities to reduce the number of kids that they were having. I think partially also because if you think about after slaves were freed, there was no work, there was nowhere for them to go, like there was no jobs for them to do. In fact, they were being basically with Black codes basically forced back into servitude. If you think about what are they called, sharecroppers, a lot of them became sharecroppers, which is basically like, you can work this land and we'll pay you $5 and then you pay us $10 for the tools. So it's like you're not, it's a trick. Anyways, there was no work, there was no rights, they didn't have rights to social services. Like I said, they still weren't human beings. So whoa, I got too hyped up. Let me back it up. Okay, so yeah, Margaret Sanger put these Planned Parenthoods in, and there's letters that she's written to different folks, including W.E.B. Du Bois, who was a very prominent Du Bois. I always forget if it's Du Bois
I
or Du
think
Bois,
it's
and then I'm like, oh God, I'm gonna say it wrong. Anyways, she was writing letters to him about it because he was also a pretty prominent eugenicist and agreed with a lot of the things that they were doing. basically, moral of the story, it was rooted in the idea that because these folks did not have wealth, they did not have jobs, they did not have the prospect of a future, they should not be having children. And it really gets down to who has the right to have children, which I think is why reproductive justice is a really interesting framework to me. Anything else about Planned Parenthood? Let me continue. No, that's pretty much it. That's still like a very prominent thing in the Black community. Actually, just last year, I gave a testimony in Iowa for the constitutional ban against abortions, and I just gave my testimony to say that why should you don't do that, and in support of abortions, I should say. And someone came up to me at that hearing, an older Black woman, and she berated me about the ways that Planned Parenthood is actually like still eugenics and still like is trying to kill the Black race, and the way that I shouldn't be advocating for abortion because abortions are just racist. And so that's still a really popular idea. I wouldn't say popular, but it's still an idea that exists within the Black community where a lot of folks don't trust Planned Parenthoods for that reason. And it's very well known, and Planned Parenthood has in the past few years done a lot more work to like share this history and to share the ways that they're trying to overcome it. Especially a lot of their work recently has been about including health equity as part of the lens that they use in their work, which is all about everyone has the right to be healthy. Yes, that's that history mostly that I know of. Would recommend more Killing the Black Body too for like more. Yes, of course. I mean, it's Googleable if you know what you're Googling, right? So if you never have heard this, like you wouldn't know to look for it. But once you know what you're looking for, there's like quite a bit of information about that out
there. Can I say something, Sue?
Please do.
Yeah. Well, I'm really interested in the subject because I am a woman and also I am an immigrant, and the Latino community is being affected by these two as well through the years. If I'm not wrong, the Chicana Movement started because the women were being they were getting the, how you say, you cannot have more kids after you give birth. They were, they were doing that to the women down there in the south. And also the another piece of the history that is really interesting to know is about how they passed the contraceptive pills in the Congress. It's because this woman, this lady, her name gets lost in my mind right now, but she went to talk to the Congress people and saying, if we pass the contraceptive pills, Black and Latinos are not going to have more kids. They do this. And she was doing that. And that's how Congress, she get all the Congress to sign the bill because us, the Latinos and the Black community is not going to have more kids. Come on. It's like, and this is really interesting. Yeah, it's really interesting to know this kind of stuff because we don't know, and we're like, oh, see, she's good because she passed it, but you didn't know how bad the thing that she was saying, no? And then it's like, it's really important to know this kind of stuff. Yeah. And also, important. Yeah, because I am a pro-woman right activist and I'm a pro-abortion. I don't take this kind of stuff in my nanny community, no, but I am a pro-abortion, legal abortion, because it's really important. It's really important that people have safe places to go to have health, their health, because the whole system is so corrupt. Like you said, we don't have sex education, and then the school girls are getting pregnant and they don't know what to do, and a lot of girls getting pregnant by rape by the familiar faces, and then you force them to have kids. No, come on, that's not right. That's what I do. Yeah, I am pro all of that. Thank you.
Thank you for sharing that. I think that also brought up for me another really good book is America and the Pill. That book is also really, really good. It talks about exactly what you just said about the ways that folks were pushing birth control pills primarily to get Black folks to stop having, primarily get Black, and actually, Chicano and like Mexican American folks specifically to stop having children. And also the fact that like this eugenics movement comes a lot out of fear that I think we still sometimes see of like that minorities are going to become the majority. And so a lot of eugenicists are like, they'll have too many numbers, like things like that, that they're like, we need to limit the amount of children that these folks can have. And then also their dependence on like social security systems.
Olivia, I wanted to ask you too, and this may go into what's going to happen in the next session, but just because it was so surprising to me, I work mostly with, well, all exclusively, I've worked with white families or Jewish families of wealth. I didn't even know there was a maternal health crisis um, or that it was affecting Black women more than any other, or Black or women of color. Can you just give us like a little bit of an overview if other people are like me and didn't know about it until I started reading articles about the work you were doing?
Yeah, totally. So yeah, we have a maternal health crisis in this country. It The rates of Black women dying in childbirth have actually only gone up in this country. They have almost never gone down, which is pretty scary and sad. Right now, they estimate that it's actually gone up. It used to be 3 to 4 times more likely to die in childbirth, but now it's 4 to 5 times nationally. In Iowa, where I live, it's 6 times more likely, which is really bad. And then internationally, we see even higher numbers, like people are 12 and 15 times more likely to die in childbirth than their white counterparts. The other interesting thing to me about the maternal mortality crisis is that it's not across economic lines, it's not across class lines, it's not across educational lines, it's specifically racial. So if you're a Black person, despite having a PhD and a 6-figure salary, you're going to be subject, like the statistics of being 4 to 5 times more likely to die in childbirth apply, which I think is very interesting. Usually when we see disparities, it's across class lines as well as racial lines, or there's usually 2 factors, but in this case, it's just racial, which I think is a nod to that medical racism and these ideas that have been perpetuated that I talked about before. And then, yeah, we also have an infant mortality crisis in America. Black infants are like 3 times more likely to die in childbirth than their white counterparts. So that's also quite disparate. And then in maternal health in general, there are quite a number of disparities depending on where you live. I know in Iowa, one of the other major disparities is preterm birth, that Black folks are having preterm births at a significantly greater rate. So yeah, our maternal health landscape is actually quite sad in our country. We also are far behind many other countries in policies like parental leave and other policies like eating while you're in labor. People really want pregnant folks to just starve while they're in labor. I don't know why. And then even things like pushing on your back, like that's not very common in the world that folks labor on their backs, but in America, it's like favored by our medical systems. So yeah, we have a ways to go in terms of maternal health in this country, not even just for Black folks and the disparities that we're experiencing, but also just in terms of creating a landscape that really supports families. Yeah, we're working on it. We're working on it.
This is a lot of very bad news for a Saturday afternoon. Thanks for sticking
I
with
know.
us,
I
everybody.
try to put happy things too. Like, oh, despite all the sad. That's why too. The part 2 is like much happier. I hope that y'all who have been through this sad hour come back with me for the second part. The second part is much more like imagination. Like, what do we want and what do we deserve? I think sometimes one of the functions of racism is to keep you tired. So to keep you from being your best self, you know. So thinking about imagining things, imagining like what do we want and what do we deserve and what kind of policies could we have, I think is really fun and more positive. Mara, hello. You can unmute yourself. Hi.
Thank you, thank you. I came a little late, as I explained to Marcia. I was in another meeting, but that's a very, very interesting topic. Not only for racial, but a women is. I studied this a little bit a while ago, but for me, was very surprised in this 21st century that a woman is still lost in their lives with all
I know.
assistance.
Me
It's
too.
unbelievable with
It blows
all
my
this
mind.
knowledge. Yes.
Yeah.
And just yesterday or before yesterday, I heard about what are the ripple effects a loss of one single person, like a mother at the moment of birth, how this affects the entire fabric of the society around her that is beyond explanation. Is very, very, is not only one person, but this affects many, many times this. And yes, it's a very sad topic, you know, but it's better we blow this pink bubble. Thank you for doing this. And thank you also, our dear friend that always is fighting as a nanny. Thank you, thank you. And yes, let's blow the bubble, but bring a new good reality in place that we can do it. Thank you.
Yes, thank you. Yes, I'm the same. When I found out that people were still dying in childbirth, I was like, "Are you serious? That seems like such a like Roman century, like such a like far away thing, but it's like so real, especially in our country.
Well,
Pretty
and
wild.
it's interesting to me, like, I'm not, I watch the news, I read, I'm involved in the world of families and children,
Mhm.
and I'm telling you, I had no idea. Just no idea. I
It's
mean,
not amazing, Sue.
nobody
It's
talks about it
unbelievable,
at
right?
all.
Mhm.
You are such a clear person, so well educated. It's unbelievable,
Yeah.
right?
It was surprising to me.
Um, Another fact that I wanted to tell you is that right now, I think it was, I saw it like yesterday or the day before, it's in the New York Times, it's an article. They say the Latino community right now, the immigrant Latino community right now, they are so afraid because, you know, under Trump administration, the immigration is really bad and ICE is doing so much bad things to the community. They are so scared, the women, to go to hospital to get birth. They are, they are giving birth at home, and it's really
Mhm.
bad. And that's
Wow.
really it's really disturbing, and it's like, wow, because people is afraid of getting deportated because
Mhm.
they're using the hospital to take people out, and then they don't
Yeah.
want that happen to them, and then start giving birth at home. And you know, I don't think they having the proper because it's not like, because these people is not like the rich, they can have the midwife and the doula and stuff like that. I don't think that's happening, and this, I think, it's really dangerous what the
Mhm.
system is doing to all of us women of
Yes.
color here.
For
Yeah.
sure. And it's also so interesting too, the way that like folks can't afford a home birth midwife or a doula, things like that if they're giving birth at home. But actually culturally, many of our communities give birth at home or in nature or wherever. Like we are not used to going to hospitals. So it's actually probably more comfortable for them to be in their homes, but the accessibility of getting a midwife to be able to come to your home, things like that, just not accessible. And then thinking about folks who even like speak your language or are knowledgeable about the cultural like customs that are used, are traditional in childbirth, things like that. Yeah, I'm actually in Des Moines working on a bill to certify professional midwives, which would be a huge step towards that issue because not only Black folks have a tradition of midwifery that is culturally appropriate and responsive and includes a lot of things that are specific to Black folks, but also people from other cultures have ways that are traditional for them to give birth and practices and um, that are custom, and there's nothing wrong with them. They're totally fine. They might just not be what it looks like in a white America. And so licensing those folks to be able to go into their community and help folks birth in a way that is appropriate and traditional and safe for them, I think is so major because people should have the option of where they want to give birth and how they want to give birth and with whom they want to give birth, because that's such a sacred thing, right?
Exactly. So I want to sort of bring this part to a close. Again, we've scheduled part two now for 11 a.m. Eastern Standard Time on January 16th. If that's too early in the morning for you, I know that's early in the morning on the West Coast. Feel free to send questions that you want addressed to me, and or we'll have it available for like we always do on the YouTube channel. If you registered for this session, you'll have to register again, but we will make sure to send a reminder to you to register you again if you don't see it on social media. And Olivia just put her email address very nicely in the chat. So if you have specific questions that you want to ask her, you can email her directly, and we'll make sure to try to get every question answered. And like she said, if this was a lot for you, which it was a lot for me, I don't know about the rest of you, um, make the next session is going to be a little bit more about what we can do and how we can get involved. I think that there's interesting things that that will come out of that for us as women and men. There are no men right now, but there are in our community who advocate for families and who know this world, what we can do to try to be more involved in this. I'm especially looking forward to that, since I feel bad that I didn't even know it was happening, and now I just want to do something. So I want to thank Olivia very much. You can follow her on social media at Kismet Doula Services. Make sure you do that, and we'll see you after the holiday season. Thanks
Yay.
again, Olivia. This was great.
Thank you so much for having me. I hope you guys all get like 5 minutes to like breathe, go on a walk. I just told you about a lot of sad shit. So take a little breather before your next thing.
It might be
Thank you so much for having me.
a Hallmark Christmas movie afternoon.
Yes, absolutely. Or like a drink.
Thank you so much. Thanks.
Bye. Have a good day, y'all.
Bye. Thank you so much. It
Everyone.
was really good. Thank you. Bye
Thank
bye.
you.
Yay.
Yay. Thank you again, Olivia. Please give
Totally.
your mom a big hug for me, and I will talk to you in January. I'll just
Yeah, heck yeah.
okay.
Sounds good. I'll see you later.
Thanks so much. Bye.
Bye.